So he has facial pain, which is tic douloureux, or called trigeminal neuralgia. There's multiple different ways to treat that pain, but that pain can be absolutely debilitating. Patients are miserable. They start off with medications, and usually the medications eventually will run their course. It may take years and years, but eventually there's a point where whatever combination of medications, they just won't take care of the pain well enough, where now we're into some sort of surgical option, some kind of procedure to see if they can take care of the pain. Multiple different procedures that can be done, from anything like a CyberKnife, which is what Mr. Powell had, which is focused beams of radiation that affect the nerve as it enters the brainstem, and thereby disrupts the pain signals from getting to the brain. There's also an open procedure you can do, where you do an open procedure and you decompress a loop of blood vessel that's pushing on that same area of the nerve, and that loop of blood vessel is what's hurting the nerve. And if you move that loop of blood vessel off of the nerve, that takes care of the pain. There's another procedure where we can go in with a special needle from the front, where that nerve kind of enters the skull base, and use either radio frequency ablation or just mechanical balloon to kind of hurt the nerve, to stop those pain signals from getting back to the brain, to a glycerol injection. All these things are used to affect that nerve and stop those pain signals from getting back to the brainstem, and then therefore the patients won't realize that pain. Trigeminal neuralgia is it can be one of the most debilitating pains that people have experienced. It's in their face. Sometimes it can be on the surface or on their teeth or gums, and it can be brought on just out of the blue. It can be just a gentle breeze blowing on the skin can cause an exacerbation of this pain to just an intolerable level. And it goes on, for patients who are affected by this, it can be all day, every day, and just so debilitating that it leads some patients, like I was saying before, it leads some patients to take their own life because they're so miserable. So if we can treat this pain with either, a medication or surgical or non-invasive approach, and then they're pain-free, I mean, you can't find a happier patient. CyberKnife is a really fancy piece of equipment at the hospital that uses imaging to guide focused beams of radiation with pinpoint accuracy in different areas in the patient, to deliver a high dose of radiation to whatever tissue that you want to affect. And so CyberKnife is a really fancy thing, but for trigeminal neuralgia, basically what you're trying to do is focus the beams of radiation on this area of the nerve to make the nerve stop and unable to conduct pain signals to the brain. And the way you do that is you get the radiation to focus just on that one very minute area of the nerve, but it's got to leave all the other important tissues, the brainstem, the orbits, the nerves around, has to leave them all normal and unaffected. And that's why this modality is so specific and so powerful. And it's really because of its accuracy. And it combines imaging, where it's an MRI of the patient, then that gets downloaded into the CyberKnife machine. The computer reconstructs a three-dimensional image. And with the radiation oncologist and myself, we get together, we pinpoint what we want to affect with the radiation and everything else that we want to leave alone. The patients come in and use that CyberKnife. And then we use that CyberKnife to treat trigeminal neuralgia. We can treat tumors. We can treat a lot of things using that machine, that modality. But specifically for trigeminal neuralgia, it's minimally invasive. There is no incision. There is no really even sensation. They come in for the treatment, they go home, and like Mr. Powell, pretty significant and almost immediate relief. The CyberKnife is pretty slick because it really, you can because you take the patient's own MRI and you use that to guide the beams of radiation. It's absolutely, it is tailored to that patient specifically, and it's pretty well tolerated. So what it is for me, I'm the planning guy, and then the machine they lay down on a table with a mask over their face that just immobilizes them because they can't move, right? And this thing just goes around them, the place where we do the CyberKnife suite. Yeah. And look at, because planning is, it's like the monitors, and you can see the patient's imaging, and then myself and the radiation oncologist saying, okay, this is the area of interest, this is what we want to hit, and then what they do is they then work out the exposure numbers, the strength numbers, the volume, because it's all predicated on the volume of what you're trying to hit.
I was wondering about like the radiation effects, like, because they're like calculating, how much you're receiving, how much is healthy, like all that, right?
Yeah. So, and that's and the spill off, because there is a minimal amount of radiation exposure to everything else around, and so the exposure to what's right around the area of interest gets a little bit, but not much.
Yeah.
And then you just want to make sure that it's a rapid spill or a rapid decrease in exposure as you get farther and farther away.
Gotcha.
So, but it gets an effectual dose on. You don't want to say lethal, but it gets an effectual dose on the area of interest, because you want to you want to impart the treatment without hurting anything. Like I said, in the microvascular decompression, there's almost no, because you're not destroying any nerve tissue with the decompression. You're just moving that artery away from the nerve, and it's the pulsatility of the artery on the nerve that's causing the pain. So as soon as you sweep that artery away from the nerve's still fully functional and normal. It just doesn't have that artery pulsating on it with every heartbeat, causing the pain. So, but the downside to that procedure is patients don't always, their pain isn't always caused by a loop of vessel. And the other thing is, to get to that vessel and sweep it away from the nerve, you have to do an open craniotomy, an open approach. Now, we do that all the time, but if you say to a patient, we could just zap you with a beam of radiation, no incision, you'll be in and out in a couple hours, versus open craniotomy, it just depends. But if there is a vessel there, and then open craniotomy is the way to go, because you don't destroy any nerves, you're just moving that vessel away, and it's and there's minimal risk to that procedure after the fact. Whereas with the CyberKnife or anything else, there always can be, the pain can come back, and there always can be numbness or other issues.